On Plugged In, over 18 million. That's the number of people around the world diagnosed with cancer last year. Some 9.5 million cancer deaths. And those numbers are projected to rise to more than 27 million new cases and 16.3 million deaths by the year 2040. What's your risk for cancer? And what can you do to reduce it? We'll take a look at the most promising research and the latest developments on the global cancer crisis and the search for a cure.
Hello and welcome to Plugged In. I'm Mil Arcega, filling in for Greta Van Susteren. Well, here's something to think about. About 18 million of you will develop cancer in the next year. And more than 9 million people who now have cancer will die from it in the next year. Now, those numbers are not meant to frighten, but to educate and to provide some perspective in a disease, that is now the world's second leading cause of death, just behind heart disease. While it's no longer the death sentence it used to be, cancer remains a deadly serious problem around the world.
From North Africa, across Europe and Asia, lung cancer is the most common and deadliest form of cancer in men, followed by prostate cancer in much of the Americas, Western Europe, Australia, and parts of sub-Saharan Africa. For women, the World Health Organization says the single biggest threat is breast cancer, followed by lung cancer and cancers of the cervix and the female reproductive organs. Along with colorectal and skin cancers, such cancers accounted for nearly 10 million deaths in 2018. And the human toll comes with a heavy price tag, estimated at more than $1 trillion each year. While the burden of cancer varies from nation to nation, it is often greatest in lower and middle-income countries where access to treatment options and early detection is limited.
So that means we still have very high mortality, and this is contributed to mainly because our patients come late when their disease is advanced.
The burden is especially large in sub-Saharan Africa, where cancer cases are projected to increase 85% by the year 2030, and in Asia, where more than half of the world's cancer deaths occurred. But ongoing research and new advances in treatment is providing hope. Johanna Wagner at the University of Zurich is using machine learning to analyze and catalog more than 140 types of cancer tumors.
Cancer is composed of different components, and our motivation, our aim was to characterize these components in detail, because we know that if we know exactly how tumors are built, we might be able to better tailor therapies in a tumor-specific way.
But researchers say new advances in cancer treatment are just part of the equation. Some of the most common cancers are preventable through changes in lifestyle, diet, and exercise. And most experts agree that prevention is one area that's making significant inroads in the global cancer crisis.
Now, prevention and reducing cancer mortality is something our next guest feels very strongly about. Dr. J Leonard Lichtenfeld is Deputy Chief Medical Officer for the National Office of the American Cancer Society. He was designated Master of the American College of Physicians for his professional accomplishments. He is also the creator and author of Dr. Len's Cancer Blog. Dr. Lichtenfeld joins us now from Atlanta, Georgia on Skype. Welcome to Plugged In, sir.
Hello.
This is a very important show for many of our viewers around the world, and we thank you for taking part in this discussion. So we've already identified the biggest cancer threats for men and women as lung, breast, prostate, and skin cancers. Does the cancer threat differ from country to country, though?
Absolutely. It really depends in large part on where one lives. So, for example, here in the United States, we've already talked about lung cancer and breast cancer. But if you go to Asia, some countries such as South Korea have substantial numbers of patients with stomach cancer, gastric cancer. Liver cancer, which is caused through infection, is also a major cause of cancer in some parts of the world. So where you live has a significant impact on what your risk may be for developing certain types of cancer.
Is there any good news on the horizon? The American Cancer Society's annual report obviously shows that cancer rates were dropping here in the United States. Are we seeing similar trends in other countries?
Well, there is good news. So we reported back in January of this year a 27% decline in cancer mortality rates from 1991 through 2016. And that's pretty remarkable due to increased awareness, better treatment, screening, a variety of things, components. We are seeing, and again in economically developed countries, similar results. The concern we have, as mentioned in the opening discussion that you offered, the concern is that not everyone around the world benefits equally, far from it. And in addition, there are also concerns about what's going to happen around the world as some of our lifestyle, some of our products such as tobacco become more common. That will have a huge impact on the cancer burden internationally.
Let's talk about tobacco. That is the single most preventable cause of lung cancer, which is now, the biggest killer around the world for cancer victims. That is declining here in the United States, but we're not seeing the same declines in other countries. Why is that? Is the tobacco companies, are they to blame for what is going on here? What can you tell us about that?
Well, we certainly believe the tobacco companies are to blame, and certainly governments around the world could do more. We've learned our lessons here in the United States. We're not perfect, far from it, but we've had a substantial decline in the use of tobacco products, as have other countries that have paid attention. The problem and the concern we have is that tobacco is making inroads in other parts of the world. China, sub-Saharan Africa, you mentioned. And it's done through sometimes lax government policies. Sometimes farmers themselves have economic issues. They have to grow crops in order to survive, and tobacco is a crop that they can grow. So we need to pay attention to the scourge of tobacco at multiple levels and try to help folks understand how serious a problem it is and avoid the difficulties that the United States and other countries have gone through literally for decades and millions of lives lost.
You know, some of that has to be economic in nature, because I was just recently last year I was in the Philippines last year, and I noticed that cigarettes were selling very cheaply there. There seemed to be a glut of it. We were able to get it for something like 50 cents US. Is that what's going on? Are tobacco companies essentially shipping out a lot of the products that are unsold here in the United States and selling it in less developed countries? Is that something we're seeing?
That clearly is a strategy on the part of the tobacco companies, and one that we at the American Cancer Society and other organizations like UICC are very much aware of. We have been working with governments around the world to try to increase tobacco taxes, which is an effective way of reducing tobacco consumption. I mentioned earlier about the economics of farming. We've been very engaged at the American Cancer Society at working with farmers. Even today as I speak, one of my colleagues is in Africa having those discussions. And trying to help people understand there are alternatives. It really takes a major effort by government, by individuals, by advocates, by advocacy organizations, by a number of people to understand how serious this tobacco problem is. And if we don't address it, we're going to see substantial increases in cancer not only for the immediate future, but for the far future as well.
Dr. Len, humans obviously are living longer. Does living longer pose an increased cancer threat?
Yeah, well, yes, it does. The greatest risk factor for cancer is getting older, and we recognize that certainly here in the United States and internationally. In a sense, what's happened in some parts of the world where the life is improving, economics are improving, lifespan is increasing, and we're also dealing with some of the other infectious diseases that have caused early mortality. So as more people live longer, cancer becomes a much greater problem.
What's your advice to someone who is now living with cancer?
My advice is to be your own best advocate no matter where you live, and that applies to around the world, whether you're in a developed or an underdeveloped country. Learn as much as you can, be your own advocate, work to get the best treatment you can, and also work with government and advocacy organizations to make everyone aware of what we can accomplish in cancer care today, what we can do to prevent cancer, what we can do to detect it early. Be an advocate to make that happen, and we will be better if we can commit to that goal.
We appreciate the work you do. Dr. J Leonard Lichtenfeld, Chief Medical Scientific Officer for the American Cancer Society. Thank you.
Thank you.
As medical researchers look for ways to eradicate cancer and the burden it imposes on societies around the world, one thing appears to be a major factor, and that is access. Access to information and access to resources and treatment options. Plugged In's Larry Lazo has our report.
India has a population of more than 1 billion, and studies show that more women than men there are being diagnosed with cancer. Exactly why is a mystery. Information about early screening is available in India. Some hear it, some don't.
When I would drive to my school, it would be playing on FM. Do this, do that. I would always change the channel thinking, why listen to this? I won't get cancer.
Everybody takes light medication every now and then, sometimes for headache or stomachache. But such a serious disease? I had no clue about it. How could I get it?
What these women have in common is that they both have an aggressive form of breast cancer. Compounding the high number of cancer cases in India is a lack of treatment options. A similar story in Africa, where Uganda is struggling with a high cancer rate and limited resources to combat it.
Even if they came early, we don't have ways of making quick diagnosis. In other words, we don't have the infrastructure, we don't have the facilities to quickly make diagnosis and treat them effectively.
The cost of some cancer-fighting drugs in Uganda have been lowered, but many of the medications remain too expensive for most patients.
I came here, they operated me. After the operation, some drugs were not in the pharmacy. I had to go to a pharmacy to buy them, but they were very expensive. So I had to go back to the village, sell part of my land so that I buy those drugs.
The common thread among many nations is a lack of early screening, patients that wait too long to be diagnosed, and having access to the needed medications and treatment options to have a chance of beating their specific type of cancer. Larry Lazo, VOA News, Washington.
So how can people in developing countries beat the odds? And what's being done to make diagnosis and timely cancer treatment available to them? For more on efforts to reduce the cancer burden around the globe, we are joined by Kerry Adams. He is Chief Executive at the Union for International Cancer Control, UICC. That's where the coordinated global advocacy group that addresses cancer issues. He was also formerly the chair for the Non-Communicable Disease Alliance, the NCDA. That is a coalition of about 2,000 organizations that are working to limit the spread of non-communicable diseases around the world. Now, he's also received numerous awards for his work, and he joins us now on Skype from Geneva in Switzerland, where he's based. Mr. Adams, thank you for taking time to speak with us.
It's a pleasure to be with you.
Now, your organization works with 170 different countries to develop and implement cancer treatment strategies around the world. Is there any sense of urgency right now in the work that you're doing?
Well, there is, and I think we're probably at the best time we've ever seen with regard to engagement from the governments around the world to put cancer as a priority within their health plans. And this is off of 10 years of global advocacy to make sure that there are various commitments made at a global level, which are signed off by each of the member states or countries around the world. And we're seeing progress in the way that they develop and implement national cancer control plans, which cover many of the areas that your previous speaker was covering and was talking about.
Now, in that previous report, too, one of the men interviewed there said he had to sell parcels of his land so that he could pay for the cancer medication that he needed. Now, some of us here in the newsroom were taken back by that. Is that something that happens often? Is that something that you see?
That is very common. Unfortunately, yes. The health infrastructure in many of the low and middle income countries do not have the benefits of being part of like the American system or the Swiss system or the English system, and that there's a lot of out-of-pocket payments for all treatments, whether that's cancer or any other disease, which befalls a family, and it often falls onto the family. So we have to recognize that in solving the problem of cancer in low and middle-income countries, we've got to take a holistic approach involving governments who need to look at the whole health infrastructure, not just about the price of drugs or the price of technology, but also educating people about the signs and symptoms of cancer so they can get into a health system that can provide the very essential medicines and treatment that's required to deal with that which we know we can treat successfully.
But any way you look at it, cost has to be a big part of the equation. I know there have been a lot of efforts towards preventing, but for those who already have cancer, it can be a death sentence if you can't afford it. It's very difficult here in the United States, even with insurance. I can imagine what it would be like for someone who is suffering from stage 3 or stage 4 lung cancer in Haiti.
Yeah, you're absolutely right. In fact, stage 3 or stage 4 of any cancer is very difficult to treat, highly complicated and very expensive, no matter where you are in the world, which is why I would emphasize that part of the challenge we have in low and middle income countries is to make sure that they have the very essential medicines and the essential technologies to deal with those cancers that are most common. And that is the real challenge we face. Now, we take our lead from the World Health Organization on this, who have a refreshed essential medicines list, most of which are generic and therefore are a lot cheaper than some of the more innovative medicines. And if that list was available in low and middle income countries, then a lot of the more common cancers, which your reporter stated earlier, would actually be treated successfully at an early stage of presentation.
Let me give you sort of a hypothetical question here, and I think it applies here about the cost and about the inequities that we see in the systems. Let's say you got 2 twins, both with the same type of deadly cancer, both the same stage. One lives in New York, the other one lives in Kampala. What is the prognosis for both?
Well, the prognosis for, on average, for children with cancer that can be treated successfully in high-income countries is an 80% survival rate, which is fantastic. And that wasn't in place 10, 15 years ago, but we're able to deliver the right treatment to the right child at the right time. And we would expect 80% survival rate. Unfortunately, in lower middle-income countries, you're looking at a survival rate of around 20%. Now, a lot of that is not necessarily the availability of the drugs. It's the fact that the child is in remote areas, the family is not aware of the symptoms, even the primary healthcare physician is not aware of the symptoms. So unfortunately, that child is not presented early enough to actually receive the medication or the treatment in the country, even if it's there. So it's a highly complicated problem, but it's something which shows the potential is there to have a dramatic impact over time to bring those sort of survival rates up higher in low and middle income countries.
So UICC is partnering with the World Health Organization. You're holding a summit later this fall in Kazakhstan. What do you hope to accomplish at that summit?
Well, the summits take place every year, and we take them to different parts of the world, and we engage the region in which we are operating the particular summit. So this year it's in Kazakhstan, as you say, and we run that summit with the World Health Organization and 2 other UN agencies. And the ambition at each summit is to bring together 300 to 350 of the top people in the world, including representatives from the American Cancer Society, discuss a topic which we believe we need to address, understand, and take back to our countries and cajole governments to put cancer in that agenda. Now, this particular one is looking at universal health coverage. There is a September meeting of the United Nations on universal health coverage. So it's quite appropriate that the cancer community reflects on the decisions taken at that meeting in New York and then decides how we can proactively make it happen for people with cancer around the world. So as governments develop their plans, they place cancer treatment and care right in the heart of those decisions.
Just one last question, because I know we're running out of time. With so many countries involved at this summit, does it ever get political? I mean, does it seem a little bit like a larger, expanded G20 meeting when all the cancer specialists get together?
Quite the reverse, actually. I'm always astonished and amazed by the quality of collaboration which actually emerges from these particular summits. Yes, it involves the UN agencies. Yes, we have ministers of health there, but it's a really diverse group of people. It's leaders in private sector, NGOs, academia, and also government officials. And what we have created over many years now is a collective responsibility that addressing cancer cannot be left to one sector. And the amount of collaborative commitments that we find from that meeting is quite inspiring, and we've seen impact as a result before.
Thank you so much, Kerry Adams, Chief Executive Officer at UICC. We appreciate it. Now, cancer treatment has come a long way over the years. It used to be strictly radiation and chemotherapy. But now, depending on the type of cancer, the treatment is becoming more precise, less invasive, and one would hope more effective. Here's VOA's health correspondent Carol Pearson with a look at the future of cancer treatment.
Chemotherapy, radiation, and surgery are standard treatments to combat cancer. But chemo and radiation kill healthy cells as well as malignant ones, and the side effects are legendary. Cancer treatment is now moving towards precision medicine, therapies that target just the cancer and not other tissue. For example, focused radiation for women with early-stage breast cancer can be used after surgery that removes just the malignant tumor. Plus, it takes less time than full breast radiation.
The short 5-day treatment is just as good as the whole breast irradiation for 4 to 6 weeks.
Other treatments use the body's own immune system.
It's not pretty clear that that immune system sees cancer cells, sees them as abnormal, and if we unleash the power of the immune system, can attack and destroy the cancer cells in a very, very helpful way.
Still, another treatment involves testing the cancer cells to determine their genetic makeup and then using medicine designed to kill only those cells.
We're talking about targeting cells at the very core of what made them a cancer to begin with. And that's what precision medicine is really about.
Each patient's cancer is unique, just like their DNA, and that's what helps determine what medicine will work best. Healthy cells are left alone, and patients' side effects can be remedied.
Very few of them have had a side effect that I've even needed to do anything about. And the couple that I've had, if I just drop the dose 1 level, not only is the side effect gone, but the treatment still remains effective. Right now, where I think the biggest impact is being felt is for those patients whose cancer is not cured, that comes back over and over again, or actually spreads to other parts of the body.
The results are very promising.
I get this patient in who's been told they're only going to be around for 3 months, and they've got a cancer that typically is not treatable. Even with chemotherapy, they don't do well. I give him this pill, and that was 4 years ago, and he has no evidence of disease. And I meet another woman who has sarcoma who's had so much, she was so sick, she was in a wheelchair and on oxygen. And in my lifetime, that person would be gone in a year. And here it is 3 years later, and she's hiking with her kids.
These therapies are still new, but cancer specialists say targeted therapy, whether focused radiation, immunotherapy, or the genomic testing followed by precision medicine, is the future of cancer treatment. Carol Pearson, VOA News, Washington.
Now, one man who is laser focused on the future of cancer treatment is Dr. Otis Brawley. He is a Bloomberg Distinguished Professor of Oncology and Epidemiology at Johns Hopkins University. He's also Associate Director for Community Outreach and Engagement at the Kimmel Cancer Center and the recipient of the Martin D. Abeloff Award for Excellence in Public Health and Cancer Control. Thank you so much for joining us, Dr. Brawley.
Thank you for having me.
I want to talk about what we just saw there. Are we going to see a cure in our lifetime?
For certain cancers, think of cancer as at least 200 different diseases. For certain cancers, we already have cures. We're going to have cures for more. But for the majority of cancers, I think what we should hope for is people who are going to have better, more effective treatments. And what we should think about is people living with their disease, like in diabetes or HIV now, where they're still going to have cancer, but they're going to be able to live more productively with less side effects with their disease for a very long time.
So that's where we are now. When we first heard of the AIDS epidemic, it was automatically a death sentence. Certain types of cancers are still considered a death sentence, but no longer the case. We're able to live longer. Is that what you're saying?
That's right. Now, in certain lymphomas, certain leukemias, we can actually cure them now. In other diseases, you just heard the doctor there talking about in certain lung cancers with certain precision medicines, we actually have people who are able to do very well for 3, 4, 5 years who used to only have a 7 to 9 month life expectancy.
Are you happy with the progress you've seen in the way of cancer treatment, cancer research?
Happy but not satisfied. Okay. We need to do better.
Where do we need to do better?
We need to do better in a couple of ways. We need drugs that work even better than we have now. You know, I can make many people who have diseases that used to die 6 to 9 months after diagnosis now live 5 years or maybe 8 years. We need to go further. We also, even in the United States and Western Europe, need to work at getting the treatments to people. In the United States, we've got data to show that perhaps 20% of people who are dying from cancer now would not die if they could get the technologies that we already have.
And of course, those technologies are important, but only part of the equation, because I know you talk a lot about prevention.
Absolutely.
Is that the key to controlling the spread of cancer?
Absolutely. In the United States, just to give you just a couple of numbers, in the United States, the death rate from cancer went from 60 per 100,000 in 1900 to 215 per 100,000 by 1990. And that's because we started introducing things having to do with industrialization and smoking that caused cancer.
We started paying attention to the causes.
If we could withdraw those causes, we could lower the death rate considerably.
We prepared a graphic here of simple things you can do, sort of basic steps you can do. Stay away from tobacco. Right? That's been very effective. I believe 20%.
Tobacco is the cause still of a third of all cancer deaths.
Use sunblock because skin cancer
Absolutely.
is a big killer as well.
Better even than using sunblock, stay out of the sun, long sleeves, wide brim hats, avoid sun exposure.
Of course, being healthy and exercising that improves your immune capabilities.
Second leading cause of cancer, by the way, is the combination of too many calories, obesity, and lack of physical activity. We call that energy balance. Tobacco smoking, number one, energy balance, number two. And these are true, actually, in the United States, Europe, and many parts of Asia and South America.
Do you see a time, doctor, when you can be vaccinated against certain types of cancer or just take a pill and say you're going to be okay?
That time is here for certain things. The HPV vaccination actually prevents cervical cancer, likely prevents 5 other cancers that are caused by the human papillomavirus. Hepatitis B vaccination is very effective in preventing hepatitis, which causes liver cancer. Indeed, in Southeast Asia, there's been tremendous control of liver cancer in certain countries of Southeast Asia due to hepatitis B vaccine. We're going to have more vaccines in the future.
What do you see as the biggest challenge, sort of in a global way, of sort of reducing the risks that the human population has?
Biggest challenge right now is getting all the preventions that you just talked about to everybody, to get people actually to focus on preventing cancer. If we just did those simple, very inexpensive things, we could reduce the number of cancers and reduce the number of cancer deaths considerably. Then we need to talk about screening, diagnosis, and treatment of those cancers we can't prevent.
Could governments around the world, could they be doing more?
Oh, absolutely.
To reduce the risks.
Absolutely. Governments have really, it's only government that can get many of these things to the populations, many of the things that are quite beneficial. We know, for example, excise taxes to make cigarettes and tobacco more expensive decreases use of tobacco. Decreasing use of tobacco decreases cancer incidence for 18 different cancers. We know that getting vegetables and fruits available to people who don't have them and getting very high caloric foods out of the population can actually reduce the amount of cancer.
Well, Dr. Otis Brawley, we thank you so much for your advice and for the wisdom and the insight that you provided us on the whole cancer problem.
Well, thank you, and thank you for getting the word out. Spreading the word is one of the ways we overcome cancer.
That is the key, isn't it? Dr. Otis Brawley, thank you so much. We have hit you, obviously, with a lot of cancer statistics today. We are, after all, dealing with a worldwide epidemic, so the stakes are obviously very high. Now, cancer is the second leading cause of death globally. Medical researchers have made tremendous progress in a more targeted approach to treatment, and they are confident that a cure to all forms of cancer may be just on the horizon. But a lot more money for research and resources is needed, and the importance of early screening cannot be stressed enough. As you've heard, many forms of cancer are curable if detected early, and many in the medical community believe that early prevention, detection, and a targeted approach to treatment holds the key to wiping out cancer, maybe not in our lifetimes, but perhaps in our children's lifetimes. And that is all the time we have for today. Stay plugged in by liking us on Facebook at Voice of America. You can also like our Facebook page at facebook.com/Greta and follow Greta on Twitter at Greta. Thanks for being plugged in.